So, role of the government in health. We have to read page number 19 to 21. So, in this topic, in this chapter, we are going to see what is health, healthcare facilities in India, right to health. All these things we are going to deal with this chapter. Yes, they are. So, how they are related with the health? Yes. What is health? Yes, you can think of health in many ways. Health means our ability to remain free of illness and injuries. But health isn't only about disease. You may have associated only some of situations in the above college with the collage with the health. So we have seen now picture and all this collage is related with the health. Maybe it is water, clean water. Maybe it is cleanliness surrounding cleanliness. Maybe it is with related to hospital, ambulance. So what we often ignore is the fact that each of the above situation is related to health. Apart from disease, we need to think of other factors that affect our health. Which factors affect on our health? For example, if people get clean drinking water or a pollution free environment, they are likely to be healthy. On the other hand, if people do not get adequate food to eat or have to live in cramped condition, they will be prone to illness. All of us would like to be active and in good spirit in whatever we may be doing, isn't it? Yes, we would like all activities should be in spirit, in enthusiasm. It isn't healthy to be dull, inactive, anxious, or scared for long stretch of time. We all need to be without mental strain. All of these various aspects of our life are the part of health. So, however, when it comes to reality, previ- uh, provision of healthcare facilities in India is not up to the level what is actually should be. So, what is health? In simple term, we can say that absence of any kind of illness would be known as health. But however, in recent day, concept of health had changed and it has moved from the concept of fitness to the concept of wellness. So, under health, we talked about remaining free from any illness or injury. It is kind of mental well being or state of mental health or illness providing adequate food, providing clean or drinking clean water, providing pollution free environment, no mental stress. That is what we broadly define under the concept of health. Got it? What is health? Okay, so let's see now next healthcare in India. Let's examine some of the aspect of healthcare in India, compare and contrast the situation expressed in the first and second column. So here you have to read the first and second column. India has the largest number of medical colleges. You can read it later also. Okay. So what is given in these two columns? India has largest nation in the world to have the highest number of medical colleges in the world. It has largest number of doctors. Then India is nowadays promoting medical tourism from many countries. Why it has happened and what is medical tourism? What is this medical tourism? That is very easy to understand. Tourism is something in simple term, I can say it's movement for people of the some activity or some reason. Reason could be leisure, recreation, or any other reason to meet family friends. One of the another reason in medical reason, medical purposes. Now there are two reasons for the medical tourism. First reason is expensive medical setup in some of the nation, for example United States. So some of the people from United States who are unable to afford the expensive medical healthcare system, they try to move to other countries for medical purposes. Then another reason, second reason is some of the nation do not have supportive infrastructure or good healthcare facilities. So people coming from less developed nation like part of Africa would come under this category, that they don't have that do not have supportive infrastructure for good health. So either of the two reasons promote medical tourism. Medical tourism has been increasing over the period of time in India. So these are the some positive point of healthcare system in India. In order to prevent the treatment illness, we need appropriate healthcare system, healthcare facilities such as health center, hospitals, laboratories for testing, ambulance services, blood bank, etc. So nowadays we know that for to prevent or treat illness, we need lot of facilities, isn't it? So we need healthcare centers, we need more facilities, dispensaries, health centers, laboratories for testing, ambulance services, so that these services that the patient need. In order to run such facilities, we need health workers also, nurses, qualified doctors and other health professional who can advise, diagnose and treat illness. We also need the medicines and equipment that are necessary for treating patient. These facilities are required to take care of us. India has a large number of, yes, we had done this. Now let's see the story of Hakim Sheikh. So Hakim Sheikh was a member of the Paskin Banga Khet Mazdoor Samiti, an organization of agricultural laborer in West Bengal. One evening in 1992, he accidentally fell off a running train and suffered head injuries. He was in a very serious condition and needed medical immediate treatment. He was taken to government hospital in Kolkata, but they refused to admit him because they did not have a spare bed. Another hospital did not have the facility or the specialized doctor necessary for his treatment. In this way, he spent 14 hours in a critical state and was taken to 8 different government hospitals, but none of them admitted him. Finally, he was admitted in a private hospital where he received treatment. He spent a lot of money on his treatment, so angry and upset over the different attitude of all the hospitals that refused to admit him. Hakim Sheikh and Paskim Banga Khet Mazdoor Samiti filed a case in the court.
If you like our videos, do share them and subscribe to our channel. If you want awesome quizzes, write to us. Keep watching and keep learning with Walnut.